This 3D animation on bronchoscopy offers a detailed and visual explanation of how the procedure works. Bronchoscopy is a medical technique that allows doctors to examine the inside of your lungs and airways using a thin, flexible tube called a bronchoscope. This sarcoidosis is a complex, chronic granulomatous disorder of unknown etiology that primarily targets the lungs, with pulmonary involvement observed in over 90% of cases. Characterized by the formation of non-caseating granulomas, this multi-system inflammatory disease can also affect the skin, eyes, heart, and lymphatic system. Despite its global occurrence, sarcoidosis often presents a diagnostic challenge due to its diverse clinical manifestations and ability to mimic other diseases, including tuberculosis and malignancies. Pulmonary sarcoidosis typically manifests with symptoms such as persistent dry cough, dyspnea, and chest discomfort, though many cases may initially be asymptomatic and incidentally discovered on chest radiographs. Radiologic staging based on chest X-ray findings ranges from stage 0 normal to stage 4 fibrosis, offering essential prognostic insight and helping clinicians tailor management strategies. High-resolution CT scans and pulmonary function tests further aid in evaluating disease extent and progression. The course of sarcoidosis varies. Some patients experience spontaneous remission, while others progress to chronic pulmonary fibrosis, significantly impairing lung function. Corticosteroids remain the cornerstone of treatment, but immunosuppressive agents may be required for refractory cases. Given its unpredictable nature and potential for organ damage, sarcoidosis demands a multidisciplinary, personalized approach to diagnosis, monitoring, and long-term care. This 3D animation on bronchoscopy offers a detailed and visual explanation of how the procedure works. Bronchoscopy is a medical technique that allows doctors to examine the inside of your lungs and airways using a thin, flexible tube called a bronchoscope. This tool is equipped with a small light and camera, which transmits images to a monitor, giving the doctor a clear view of the respiratory tract. Before the procedure begins, you'll be given a sedative or mild anesthesia to keep you calm and comfortable. Once you're relaxed, the doctor gently inserts the bronchoscope through your nose or mouth, guiding it down your throat and into your lungs. The process is usually not painful, though you may feel slight pressure or a cough reflex. During the procedure, doctors may collect samples such as mucus, tissue, or small biopsies to help diagnose infections, inflammation, or lung diseases like sarcoidosis or cancer. The entire procedure typically lasts between 30 to 60 minutes, and most people are able to return home the same day with minimal recovery time. Role of bronchoscopy in sarcoidosis. 1. High diagnostic yield. Bronchoscopy offers a high diagnostic yield in sarcoidosis, especially when used with procedures like transbronchial lung biopsy, TBLB, endobronchial biopsy, and transbronchial needle aspiration, TBNA. These techniques help confirm the presence of non-caseating granulomas, reducing the need for surgical biopsy. 2. Key indications. It is indicated in patients with unexplained bilateral hilar lymphadenopathy, persistent respiratory symptoms, or abnormal chest imaging suggestive of sarcoidosis. Bronchoscopy allows direct visualization of endobronchial lesions and provides tissue samples for histopathological confirmation. 3. Limited therapeutic role. Though primarily a diagnostic tool, bronchoscopy has a limited therapeutic role in sarcoidosis. It may be used to manage airway complications such as obstruction or bleeding, but does not directly treat the granulomatous inflammation. Its main value lies in guiding diagnosis and staging. Bronchoscopy enables several key diagnostic techniques to evaluate lung and airway diseases. These include bronchoalveolar lavage (BL) to collect fluid from the lower airways, transbronchial lung biopsy (TBLB) for sampling lung tissue, and endobronchial biopsy (EBB) for visible airway lesions. Endobronchial ultrasound guided transbronchial needle aspiration (EBUS DBNA) allows precise sampling of mediastinal and hilar lymph nodes. Together, these methods help diagnose infections, sarcoidosis, cancer, and other interstitial lung diseases with high accuracy. Bronchoscopy is a safe and valuable procedure for diagnosing various lung conditions. Careful patient selection, proper sedation, and skilled technique are essential to minimize risks. Common complications include mild bleeding or temporary cough, while serious events are rare, with a high diagnostic yield, especially when combined with advanced techniques like EBUS. Bronchoscopy remains a cornerstone in respiratory diagnostics, guiding effective treatment decisions and improving patient outcomes. Thank you for watching Medicology with Pro Farouk. Working with Medicology has been a rewarding journey, allowing me to blend medical education with visual storytelling. I created simplified, evidence-based content using 3D animations to help learners better understand complex topics. This experience enhanced my skills in medical communication and digital education, while contributing to a platform that makes quality medical knowledge accessible and engaging for students and professionals alike. Subscribe to our YouTube channel Medicology with Pro Farouk for more visual medical content, 3D animations, and simplified explanations of complex topics. Empower your learning, one video at a time.